Good afternoon, everybody. Welcome to our final session on training for CHFP. John and I, and of course, Lynn, who's been supporting us through this, and Diane are thrilled to have you all here. We're going to give it just another minute to see if anybody else joins us, and then we'll get started going through the various recaps, some questions, and then we'll get into module 2. Now, if everybody can make sure that you're on mute, we are recording this as well. If you have a question, either please put it in the chat or the QA. We'll be monitoring that for you. And then certainly we'll open it up at any point in time at the end to go through questions as well. So I'm going to kick it over to John to get us started. We're going to kind of partner here in reviewing each module pretty quickly. So John?
Thanks, Christine. And again, thank you guys for spending your lunch with us for the past several weeks. A huge thank you to Diane and Lynn for supporting Christine and I. So I know, Chris, this is something Christine and I are passionate about. We've enjoyed doing. Of course, this is not goodbye. It's till next time. But we just want to make sure you guys have the information you need in the contacts that you need. So going forward, that once we, in the sessions, that you'll have information, you can always reach out to us. But, if we look at the past couple of weeks, we went through module 1, which is the business of healthcare. We're going to touch on module 2 today, which is operational excellence. But, with module 1, we had 6 courses, and I'm going to kind of highlight a little bit on course 1, the big picture, and then Christine will go into course 2. So keep in mind, when we talked about the big picture, we looked at describing the structure of the U.S. healthcare industry, understanding the impact of healthcare reform on the industry, explain the payment systems, and explain the role of financial management in healthcare. And that was just it on the big picture.
Are we on module 2 now? Sorry.
Yes.
Yeah, sorry. So what we did in module 2 was really talk about the basic elements of accounting. Managing any business requires a basic understanding of financial management. Accounting is a way of keeping track of the resources to get work done and enables the measurement of financial results of business operations. So the key concepts that we went through during course 2 was the basic accounting principles, double entry, and everything is in balance. We talked about assets, we talked about liabilities, net assets are equity. We talked about accounting basics and the matching principle, where you match the revenues earned in a given time period with the expense incurred to earn that revenue. We went through the generally accepted accounting principles, our GAAP, and then the cash basis of accounting, and then certainly key financial statements, which are your income statements, your balance sheets, and the statement of cash flows. And we talked about the balance sheets where assets equals liabilities plus net assets equity. The statement of cash flows from operating activities, cash flows from investing activities, and cash flows from financing activities. And we focused on the relationship between the balance sheet and the income statements. So again, just an overview of those. John?
Okay, continuing on module 1, course 3, cost analysis concepts. And there again, a couple of key terms, and I refer back to the online study course in addition to the study guide that we gave you guys. There again, use this for a tool as we go through this when you get ready to study for the exam. But basically, some of the learning objectives that we took from course 3 was define the term cost for healthcare services, differentiate the ways that costs can be determined for healthcare services, identify various methods for cost allocation in healthcare organizations, and determine how costs are used to identify prices in healthcare organizations. So again, know cost, know what kind of costs there are, direct, indirect, those type of things. And again, I think I know in the study guides, there's some definitions. And for me, with the accounting part, those definitions, those words and definitions really help me get through course 3 and 4.
So as we get into module 4, we focused on strategic financial issues and focused on why healthcare organizations engage in strategic planning and budgeting. Knowing how to use financial statements enables the interpretation of data in order to identify opportunities to improve revenues or collections, optimize operating costs, or improve profitability. We talked about the starting context of planning and budgeting. We talked about the basics of strategic planning, and it starts with the fundamental steps that include a mission statement and vision statement and the overarching strategic plan. What is the mission is, what does that business intend to do? Or what is the purpose of this business? So as of the mission of XYZ Hospital is to provide high quality care in a state-of-the-art facility. Certainly then what is their vision? Focuses on that. And then once equipped with a sense of the mission and values of a business entities, managers can then set out a broad plan to guide the organization towards fulfillment of its mission through their strategic plan. And then the strategic plan becomes the foundation for budgeting in a healthcare business. And in many respects, an organization's budget is an expression of its strategic plan in numeric terms. We focused on basic budget concepts, understanding that it is a management tool, not a financial tool, and that budgets set targets and objectives based on a plan set out by management. We talked about top down versus bottom down, and that which budget is prepared varies depending on the size and management style of the entity. We talked about monitoring budgets, approaches to budgeting, such as incremental or zero-based budgeting, and then elements of the budget for a healthcare business, such as financial planning resources, operating and statistical budgets, revenue budget, expense budgets, and capital budgets. And if I don't say budget again sometime today, I'll be a happy camper. But back to you, John.
Course 5, Managing Financial Resources. Some of the learning objectives we took away from there is how healthcare providers are reimbursed for services. So keep in mind, course 5 to me was basically the course for revenue cycle. So, know reimbursements, know what capitation is, know payment plans, just kind of know what's going on with the revenue cycle. But again, recognize the types of reimbursement methods used in the healthcare industry, describe the processes by which a hospital or physician clinic bills insurers. That kind of gets back to the charge master, the UBs, the 1500s. Calculate metrics as used to manage the revenue cycle. That's when we started talking about benchmarks and utilizing those both internally and externally. Name resource management resources in a healthcare business, and recognize the message that healthcare business finance receivables and acquire capital equipment. So again, kind of getting back and focusing on the revenue cycle when it comes to course 5, which was one of my better chapters and easier chapters when I was studying for the exam.
And the final chapter, which is focusing on the future of healthcare, so to speak. And I think we all know the healthcare industry has been in a constant state of change and will continue to be in a state of change as we deal with the issues related to quality and value. Certainly since 2010, the Affordable Care Act dramatically accelerated the pace of change with its health insurance market reforms, expansions of coverage, and healthcare delivery system transformation. So we focused on the evolving models of reimbursement, things like fee-for-service reimbursement and the incentive to providers to provide more services in the current model of fee-for-service. We talked about capitation and the pros and cons of that, and that it has had some success in reducing the incentives for fee-for-service reimbursement. Talked about other various reimbursement models that we've been trying to use in the industry. Things like patient-centered medical homes, which is a primary care delivery model intended to organize providers into a coordinated team to meet the majority of a patient's healthcare needs. We talked about for accountable care organizations, or HCOs, which really encourages providers to work together to keep patients happy. We focused on their challenges and certainly some of the risks that come along with ACOs. Talked about bundled payment, which is essentially a fee-for-service type of payment where they collaborate care delivery, meeting funding autonomy, and they collaborate on rewards and risks. Focused on MACRA and how it's moved more to a merit-based incentive program and alternative payment models. And why the point of that was. We certainly focused on the drivers of consumerism, right? And price transparency. What does that really mean in the industry? And really, where is that going? And why is that important? Certainly, BA and BI, as we go into alternative payment models, business analytics and business intelligence is critical to providers as they identify value and quality. And that the key factors in that is data strategy, data availability, and data integrity. And really where the industry is going is aligning to drive value, where value is defined as quality in relation to the total payment per care. Okay, so I think we have some questions that we're moving on to after this, Lynn, is it correct?
We do.
Wonderful.
Shall we read it or just let everyone read for themselves?
I think they can read it for themselves. Yeah. I think we're giving everybody about 45 seconds to answer. Diane, are you timing us over there? Huh? There you go.
Okay, it looks like 44% chose the correct answer, which was D. The purchaser is likely to contract with a third party to pay for services. I think we can go on to the next one.
I'm hoping I get these right.
First one was a little, again, it's wording, nuances in wording.
Without a doubt. I got the first one wrong. Just so you know.
And Lynn, aren't you seeing a lot of that on the online courses when
Yes.
it relates to the wording?
You truly have to, and you know, we were talking earlier about how long the exams are. 75 questions in 90 minutes. It seems like, you know, I'll be done in 10 minutes. But
No.
you really have to really look at the wording in both the question and the answer. Okay, so 93% got the correct answer on this one. A fiscal intermediary is an organization acting on behalf of CMS to administer Medicare payments.
Got it right.
All right, next one. The accrual basis in accounting. Now, some of these I included as questions because they were ones that I wasn't sure of when I was practicing. So that gives you an idea of where I am at with my testing skills. Okay, the correct answer was number one. We had 86% get that one correct. Using a reasonable estimate for revenues and expenses until the true amount is known is the process of accrual basis of accounting. This one I got wrong every time I took it. Every time.
It's actually a good question, though.
It's the names of the statements that keep tripping me up. Like I know what's on them, but you know. Okay, so clearly I am not alone, but the correct answer is income statement. 65% answered that one correctly. I don't feel so bad now. I just have to keep drilling it in my head. Okay, awesome. Everyone got the correct answer. B, assets, liabilities, and net assets at a specified point in time. It's what the balance sheet describes. Okay, this one was a little tricky. The correct answer was receivables on both statements. Again, one clearly I kept getting wrong in my studies, which is why it's on here. And it goes back to, again, looking at the wording. So it says the most significant link is. They're tricky. Okay, this one, 50% answered equity. The correct answer was capital structure. I'm seeing a pattern here that you're all sharing with me. There's just a couple of courses in here that I need to go back over before I take the test, dealing with the reporting and statements and things like that.
Yeah, I agree with Lynn. Definitely some of these financial formulas and things like that are the ones that I focused on the most.
So it's course 3 and 4, I think, right?
Yeah.
Yeah, I'll be going back over them again this weekend. No, tonight and maybe tomorrow. Be on the road this weekend. Okay, so actually the correct answer on this one for marginal cost pricing approach requires determining how much cost to include in pricing. Only 2 of us answered that one correctly.
It wasn't me.
Clearly establishing a minimal cost that a unit of service can be provided. I believe that's break even. Did I learn something in the courses?
Hmm. Why do I think that's a sneaky one?
Mm-hmm. Again, I can't say it enough. And you know, I had in my mind sometimes some of the questions have a key word in there that's also in the answers. Doesn't work for this question, which
So
is
I,
why I put it in
so I
there.
got it wrong.
I'll said it numerous times, you got to study the material
Yeah.
as it's presented.
And
And that
truly,
is so true.
don't be a skimmer when you read. I'm a skimmer, and I usually miss the most important words, apparently. So the correct answer on this one was target cost pricing. So we were kind of split a little as far as what the answers were here. Um, I think we have 2 more.
These are actually really good questions, though.
See, these are the ones I kept getting wrong. I told you that's what I was going to do because more reinforcement.
I think they're easy. These questions are easier for people with a background in accounting versus
Mm-hmm.
those with background in revenue cycle.
Yeah, you can see we're kind of heavy on the accounting questions in here.
Mhm.
Rev
Which is a
cycle
good
is a
thing.
piece of cake. Okay, so the difference between current assets and current liabilities is called working capital. 56% of us got that one correct. I may have gotten it right at one time, but did not get it right when I was using, putting together the questions for today. So, and our final question for module 1. Excellent. Most of us didn't get tripped up in the wording of except all the following are features of an accountable care organization, except an ACO is exempt from population health reimbursement mandates. So not too bad. It sounds like we're all kind of in the same boat as far as where there's some extra studying to be had before taking the exam. Let me stop sharing for a minute and I'm going to queue up the module 2 presentation. Okay, while I am doing that, we have a question from Paul. Can you discuss details of the exam? If you fail, what happens? Where do you take it, etc.?
So this is what happens. If you go out and take Module 1, which is the business of healthcare, and you don't receive a 70 or better, that's okay. You can take it again in 30 more days. So, if you don't pass the first time, in 30 more days, you can take it again. And, with your membership, you can continue to try. Again, I can't emphasize enough, it took me 3 times to pass it. So that's okay. And I think a lot of us are afraid to go out and not pass it. So yeah, long story short, if you don't pass it, take it again within 30 days. And then in addition to that, my recommendation is that once you pass Module 1, go into right into Module 2, which is Operational Excellence. But Lynn, I know we got some updates from the association this week regarding what's going on with the exam. You care to update the group?
We did. For a brief period, there was an issue with the scoring where we were not getting automatic scoring on the exam. So we were having to wait for them to be manually graded, and it was about 48 to 72 hour lag. So that has been corrected. So yay, we can, if you pass Module 1, barring any issues with the site itself, you can go directly into taking Module 2. One of the other things that we were talking about as far as exam, Module 1 is multiple choice questions, and it'll be similar to the types of polling questions that we've been doing throughout the presentation. Module 2 is going to be 8 case studies, and there are 7 multiple choice questions attached to them. And John did confirm today that while you're trying to answer those multiple choice questions, you will still have access to review the case study. At the end of this slide presentation, we're going to have a condensed version of a sample case study and some sample questions. John, you were saying they could be up to 10 pages long, the case studies?
10 paragraphs.
10 paragraphs. Whew, thank goodness. So that's the reasoning behind the 3 hours for just answering some questions over 8 case studies. So I think we can just go ahead and get started now that all my technical difficulties have ended and I have the correct slideshow up.
Sure, we'll kind of, like I said, Lynn was saying, we'll go ahead and do a quick overview of Module 2, which is the Operational Excellence Introduction. Okay.
John, I'm going to defer to you on this one since I didn't take this exam. So if you don't.
Christine, that's fine. That's fine.
Yeah, thank you.
So basically, kind of like what Lynn said, the Module 1 is, here's the question, here's your four multiple choice answers. When we get into Module 2, we are going into case studies. These could be 2 or 3 paragraphs. These could be up to 8 paragraphs. So there again, you're going to have to take the time to read them. In some scenarios, I read probably through them 2 or 3 times. But, when you read through them, you basically can refer back to the case studies. And then once you finish up that scenario of case studies, you'll go on to the next one. So, but basically, again, everything that you learn in Module 1, it applies to what you do in Module 2. So, kind of like the big picture, you have a multidisciplinary perspective and business savvy, which is, pretty much what we're doing here as far as, getting the credentialing that we need, for our careers. And, for Christine and I, who would have thought we would be in, helping you guys get yours, but it is something that is beneficial.
Mm-hmm.
So this tells you a little bit about what operational excellence is. It's 8 random business case studies. They can be related to payers. They can be related to physicians. They can be related to providers or hospitals. 7 multiple choice test items for each case study, a total of 56 questions. Response to the case studies, test items are aggregated, and then a score is calculated. And then this 3-hour timed exam. And just so you know, like with module 1, I did take 3 times to pass, but with the module 2, for me, it was easier and I passed that the first time around. Know your context, there again, getting back to module 1, know what you learned in module 1, understand a strategic plan, familiarize yourself with business goals of the organization, what are the barriers? And this is all kind of addressed in numerous case studies within module 2. And again, some advice from the association, approach your job like a case study, get fully involved, practice applying new skills, seek out feedback. Talk a little bit about skills for module 2, problem solving, get the details in the business context, identify the stakeholders, what do they want, outline business goals, what are the challenges, seek out data, evidence, dynamics to understand what is happening, and make a recommendation for the solution. So this slide right here really is a good slide that basically what the questions are going to be asked on when it comes to the numerous case studies. So when we talk about payer case studies, these are just tips for you to know. Again, a good study guide for definitions of words, that type of thing, anything from the ACOs to the payer considerations, health insurance exchanges, etc.
I believe that this slide and the next 2 actually are categories that those case studies will fall under if the samples that we have are any indication.
Okay, good to know. And again, we talked about module 1, now we're talking about physician case studies and some examples of that, and then provider case studies. So here is an example case study. What do you guys think? We should read it, or does everybody want to read it on their own and then we can answer the questions afterwards?
Yeah, it's a lot of words. I would probably, if you can see the screen, I would go ahead and read it for yourself. There are 3 questions that follow. That's why I also sent out the PDFs with this on here in case you need to print it if you're not, if you're joining on your phone or what have you. And this basically is what I was talking about in one of those categories on the physician slide, physician alignment sample case study. I think that's how they roll out in the module 2 exam. So
yeah, but so let's take a few minutes and read this, but this is an excellent example of what module 2 is all about. Mm-hmm. So let's take 3 or 4 minutes, give everybody a chance to read it.
Yeah.
Okay. Okay, I think we're good on time, so let's just move on to the questions.
So we'll give a little bit more time on these than typically, maybe a minute and a half, Diane. Unless everybody's answered, and then we can just,
Sounds good.
perfect. Okay, so we've everybody answered. And the answer was C. New General Hospital put a strong foundation for physician alignment in place by conducting a strategic operations alignment review to determine the level of desired alignment. Again, this is one of those wording things. And if you go back to the case study itself, it talks about their investigation on how they wanted to do that alignment, as opposed to inviting physician leaders and conducting market research and items like that. So are you ready for the next question?
So John and Lynn, I have a question for you on this. Do you have access to reread this while you're taking the tests that align to it, or the questions that align to it?
Excellent question. Yes, you do.
Okay, all right. Yeah, as I mentioned to John, I didn't take this version of the exam. When I took it, you focused on your area of focus, like revenue cycle or finance. So it was a little different when I took it. So.
Well, and what I would do, Christine, I would read the case study, and then depending on the actual question, I would kind of go back to that paragraph and reread it.
Yeah.
So yeah, it is available throughout the entire exam.
That's good.
Okay, so it looks like 73% got the correct answer. And I think that the other answers were because we missed that keyword at the end of the question, except key business reasons for extending the electronic medical record to all physicians would be including all the following except. And the correct answer is assist physicians in determining patient copays. We have one final question.
And again, I just think this is an excellent example of what Module 2 is all about.
Okay, so it looks like 67% got the correct answer. In working on aligning with physicians, new general hospital must become increasingly multidisciplinary in its business discussions and decisions. This will require hospital leaders to build trust and confidence in the business case by employing evidence-based best practices with the physicians. So it looks like the majority of people who answered the poll questions get that whole relationship as far as what these multiple choice questions are going along with the case study. Before our session, I think it was late yesterday or early this morning, I did send out, I think for a second time, module 1 sample questions. I believe there were 50, and the module 2 sample questions, I want to say there were 3 sample case studies in there. So if anyone did not get them, just let me know and I can resend them. Also, I did miss, let me just go in the chat here because we've got some things here. Where to take the test, that's going to be on the HFMA site. After you log in, you would go to my e-learning. I believe I sent out a screenshot. I can resend it to everyone. And then you're going to be looking for the course that is on my screen anyway. It's all the way to the right. It's the business of healthcare. I can see if I can get to that on there. And the answer to the first question in the case studies was yes, C, Susan. Let me see if I can get to that part on the HFMA site and show you what I'm talking about as far as where to go. Brad has a question about the last question on module 2. Diane, can you put up that last polling question again? Okay, Brad, if you want to come off mute, maybe.
Yep, I'm off mute. Yeah, I'm curious. I did not get the correct answer here, obviously. And I'm trying to understand what, and I went back and read the case again to look for some key phrases or key words that support that the answer of employing evidence-based best practices was the correct answer. And I'm still reading back over and I'm missing it, but whatever the key phrasing was that took me that direction. Everything I read seemed to be, I mean, it said there was a lack of clinical integrity. I can't see the text for the,
there we go.
the question.
Sorry. Go ahead. Can you see it now?
Not yet. Oh, I can minimize. I minimize. There we go. There it is. Yeah, I saw that there was alignment of purpose. Anyway, I'll just pose a question for those of you who got it right. What did y'all see or read? Okay, Paul answered with
right.
Process elimination. It seemed to me that the comments in the text seemed to drive toward more economic alignment than clinical alignment.
Let's see.
And that's why I passed on that answer for evidence-based clinical practices or best practices. I didn't read I didn't read the clinical focus that the answer supported.
John or Christine, do you have any insight on that? I know I'm putting you on the spot because you probably didn't read the whole case study before.
I mean, and there again, I'm real cautious about basically kind of taking what's come from the association. I'll be glad to send it over to the association and kind of get their feedback. That's not a problem at all. But again, like, you know, the questions and everything we're actually getting from the actual exam. So
see, here's my concern. if I read all the study materials, if I read it, diligently, I think I would pick up on what the appropriate answer is going to be. But there have been several of these. Several of these have like two answers are really close. I mean, you could go either way, 50-50, seems like when I first look. But when I go a little bit more tightly into some of these, I would think that the study materials would lead you to an obvious conclusion if you in fact studied it. And every now and then I miss it completely. And I'm thinking, well, I don't know. Was there another paragraph I didn't read that wasn't there or something?
No, I agree with Brad. I'm reading this too. And I'm kind of struggling as well with trying to come out with that. I don't see anything in the question that really throws me to go to evidence-based, clinical care.
Yeah,
No, I completely agree with Brad. And
I
again, I
chose
think it's
being, got it
something we
wrong.
kick back to Shirley and say, hey, yeah.
I'm wondering if it's something in the 5th paragraph that they're interpreting. The other thing is, I would definitely strongly recommend working on the other sample questions for module 2 that were in your packet for this week, just to again get a kind of a feel for how those questions are going to relate to the case studies. And even like Brad said, I try to key in on certain things and sometimes there's just no connection, but at least you'll get a feel for what you're looking at. Unfortunately, you don't have a lot of wiggle room in module 2 because there are only 56 questions and it's still 70%, right, John?
Yes.
Yeah, so I get it. But has anyone not received the sample questions and the keyword, the key concept guide and the key acronyms? Tried to send out a bunch of information with yesterday's email just to reinforce in case something happened that your emails got stuck in a spam filter or got hung up behind a security in your company's emails. So I think we can close out the polling questions. Does anybody have any other questions on module 2? Oh, I was going to go and check and see if I can get to the website. Give me a sec.
One of the things I will share with you, and I think absolutely if you have anything on the exams, whether it's module 1 or module 2, where you highly disagree with the answer, then I would bring it to myself or bring it to John so we can bring that to national. They are very open to, reviewing that information. The Board of Examiners is responsible, and those are HFMA volunteers that are all in the industry, are responsible for working with national to review the actual statistics related to the exam. And so any question that is answered, 100% accurately all the time, they're going to look at that and say, that's too easy. Anything that is looked at and is answered very rarely correctly, they'll analyze those questions and possibly readjust it to say it's too difficult, right? Or it's wrong.
Right.
And so, certainly that is something that BOE and National are willing to adjust those as necessary.
Okay, so accessing the test, after you log in, you're going to go to My eLearning. And scroll down to course. And it's this one, HFMA Business of Healthcare. The whole online course is there. And when you get to the end, that'll be the test. And you have your little code of ethics and It'll tell you what your time limit is and the grade and everything, but that's where you're going on the HFMA website is right over here on the right. HFMA Business of Healthcare. Don't use the one on the left that I use. I took that whole course and that was not the correct one. It's the same material, but it doesn't go to the correct test. This is the one. Anybody have any other questions or comments? Trying to find the chat now.
Yeah, and just to clarify, you can't access module 2 until you pass module 1.
And in the past, we were having some issues having the site actually recognize that you are eligible to take module 2. If that's the case, then John, Christine, do you want them to email you to contact National, or how do you want that to, or I think there's actually a contact email on there if there's issues.
There is. Career Services is the correct area, but certainly if somebody reaches out to HFMA, it's very rare that they don't get back to you timely. We're certainly happy to assist you as well by reaching out to National as well. So happy to do that.
Okay. Hopefully that little bug has also been worked out. I know, they did a lot of work updating the website. The online course is fabulous now, and there's always little kinks in everything.
Always so. And certainly John and I are open that as you move from module 1 and successfully pass it, and I have no doubt that you will, that you move on to module 2, we will be happy to do another session focusing on module 2 as well, if you'd like to do that. So, do 1 or 2 sessions and walk through that as well. So just let us know. I'm actually going to see if HFMA will give me access to module 2, so we can prepare for that as well.
I wonder if we couldn't also get or find additional sample case studies to get a feel to how they're gearing those questions to the case studies, because it is about interpreting what they're looking for.
Yep, we can certainly work with National to do that as well.
Yeah, perfect.
Awesome.
And when you guys are studying, there's several ways. I know my team, we probably have 4 or 5 people that are studying for the CHFP. So what I've done next week is kind of brought them all into a conference room and said, log in, take your exam. So, again, I think once we get past that phobia of possibly failing and then being able to start doing it on our own, and then realize what you were not strong in when you took the first exam, and go back in and study a little bit more and go back and take the second exam. But again, if there's anything with what I'm getting at, is there's anything with Christine and I can do, like a quick study session for a group or whatever you'd like to do, we'll be happy to do it. Because again, the benefits of this exam in your career, if you kind of look at the career path within HFMA, you have the CR, then the CHFP, and then the CHFP is the only exam that will lead you into fellowship for HFMA. So it's a great career path. It's great knowledge to have. I think whether you're on the vendor side or the provider side, by having those, that acronym at the end of your name, it shows that you get it and you understand it. So
I completely forgot about the 2 slides that we did for FHFMA. Did I say them right?
You did.
Okay, let me just get this into slideshow and.
Well, if there are no more questions, I do unfortunately have to jump to another call. Work does call. I want to wish you all a lot of luck. I am certain if you focus on it and study, you will pass it. But John and I and Lynn, when she passes next week, which we're sure she will, no pressure there, Lynn.
None at all.
We're here to help you. So thank you very much, guys. Good luck. Let us know if you need anything. John, I'm going to jump.
Thank you,
all
Christine.
right, thank you, Christine.
Yeah. Bye.
Bye.
Good luck, everyone. John, did you want to look at these 2 slides real quick, or?
No, I think we're good. But again, we'll send this out with our final document. But again, this kind of tells you a little bit about what to do when you get eligible within 5 years after you've had your CHFP. But again, everyone, good luck. You know, if you have any questions, you know, don't feel, you know, reach out to us. Let us know. Again, I don't mind. I work with, in Georgia, I work with the CPAR program. So pretty much I'm getting questions all year from that. So again, anything Christine, Lynn, and I can do for you, let us know. All the best of luck to get this exam. And I'm sure when we meet again, or I see you guys out somewhere, you'll have CHFP. So thanks,
Thank you.
everyone.
Perfect. Thank you again, everyone, and good luck.
Thank you.
Bye-bye.
Bye-bye.